And Nigeria's National Association of Resident Doctors has threatened to embark on a nationwide strike on the 1st of April over poor welfare packages and dealing with the COVID-19 patients. Well, this followed the expiration of a 60-day ultimatum given to the federal government on the 25th of January for the payment of salary arrears and COVID-19 arrears. The association says it has lost 17 doctors since the pandemic began, adding that families of deceased doctors are yet to benefit from the death in service insurance scheme. It also wants the 5,000 naira hazard allowance raised. The body says the only way the strike could be averted is the payment of salaries owed by March the 31st. Well, let's now bring in Dr. Chukwujama Ejiofor. He is the second vice president of the National Association of the Resident Doctors here in Nigeria, and he joins me now from our offsite studio. Thank you so much, Dr. Ejiofor, for joining me in the studio. Well, let's talk about this conversation. The fact that the resident doctors, sometime last year, you threatened a strike, and eventually you had meetings with the federal government, and eventually that strike was averted because promises were made. Talk to us about why on the 1st of April, you're looking to embark on a nationwide strike.
All right. Thank you, Amaka, for having me. First of all, an ultimatum was instituted by the association as far back as January, which was meant to elapse, which is still meant to elapse on the 31st of March. And in our last meeting that held on the 27th of this month, just a few days ago, our communique was very straightforward to government that we are actually now going to embark on this strike. We have made these demands for quite a long time. We have a lot of our members suffering so much and being denied their privileges as even human beings first, before Nigerians and doctors. And this strike is still avoidable if the government does the needful. That is where we are at this point in time.
Ejiofor, talk to us exactly what your association, that's the National Association of Resident Doctors, are demanding from the federal government. Because I do know that the Minister of Health, Dr. Osage Hanire, had actually made a promise that the fact that your hazard allowance and even allowances for those who are dealing with COVID-19 patients were going to be upped. This was an announcement made back in March of last year, exactly 1 year after. Where are we with that?
Okay, thank you. First of all, it's not just about saying that this was going to be done. If you say you're going to do something, then do it. Make it palpable. That's actually what we've been asking for many years. It's not a matter of every time we agitate for what should be ours to alleviate our fears and sufferings. It's always we will, and in the long run, we're back to the same table, talking about the same thing year in, year out. Of importance at this point in time is the issue of the process of central placement of the house officers, which has been totally messed up, especially by the registrar of the Medical and Dental Council of Nigeria, which has left our members who have been working uninterrupted for 3 months now without a kobo. A lot of these young doctors have been fainting in hospitals due to low blood sugar. Nothing is being done for them. In our last executive council meeting, the council actually called for a sack of the registrar due to this gross incompetence. And I mean, if the Federal Executive Council made a proclamation in 2017 to have this central placement done. It's been 3 years, and at the end of 3 years, we still have issues. It's incompetence, and Nigeria has to move forward. And the association has called for a sack. Other issues have to do with arrears of doctors' salaries across board, especially those on the gift list. We have some centers like ABSUTH that have been owed for 20 months. I mean, we all work, and it's mind-boggling to hear that a human being in this country in 2021 is being owed salary arrears for 20 months. Recently, I heard it's just everywhere across the country, mostly in the state tertiary institutions. And this is so unfortunate. The implementation and domestication of the Medical Residency Training Act is something else that we are agitating about. It's an act of the federal government of Nigeria. It's a law of this country. And why can't a law be implemented? There are a lot of questions for us to really ask our leaders in this country. And every year we come here and it's always the same thing. It's actually quite frustrating and infuriating.
Absolutely frustrating, Dr. Ejiofor. And from the research that we have done, we hear that about 12,000 doctors every single year leave Nigeria for greener pastures all across the globe. And the fact that the Nigerian government, as it stands right now, we have been told most resident doctors, especially the ones who started work sometime late last year, for 4 months, they haven't been paid their arrears, especially those of them dealing with COVID-19 patients. So right now, you have threatened that there will be a strike on the 1st of April. What would you want the government to do right now to avert a shutdown of, the health systems in Nigeria, which is already struggling as it is?
Okay, thank you for this very important question. The government knows exactly what they have to do. They have to get things right. It's not just coming to talk about brain drain and talk about a lot of things. Fix the problem. We have, for many years, been paid 5,000 naira as hazard allowance. And it is horrible when in this same country, people receive 1.2 million naira for hardship allowance. There are some things that we have been trying to hold back upon. And I'm sure that this rot in the system is not just about the medical profession, but about others. But right now, we have doctors who are dying, getting infected with the COVID-19, even down to Lassa fever, yellow fever, everything. And nothing is being done about their welfare, which is quite unfortunate. The government knows exactly what they have to do. This strike is still preventable. Nobody really wants to go on strike. But we have to. We have to make that statement of fact that things are not going well. We have to keep our doctors within the shores of this country. These are the problems. These are the issues. They must be solved. And the ball is in the court of the government at this point in time.
Absolutely. Well,
enough
Dr.
is enough.
Chukwujama Ejiofor, there, the second vice president of the National Resident Doctors here in Nigeria, talking about the fact that the strike that has been planned by the association can be averted before the 1st of April. Well, it's up to the government now. Well, thank you so much, Doctor, for joining me tonight on the program.